Hello, everybody. Welcome to another episode. We are so proud to share with you here with the DHN Network. I am your host today. My name is Sepi Browning, and I am here with my friend, amazing leader in our community, Marie DiFrancesco. I am so happy to have her with us today. We have an amazing topic that we want to talk about. She is my friend, amazing colleague and leader that I respect so much. She is a nurse. She's been in healthcare IT in our community here in Georgia for over 20 years. And she is the CNIO at Northeast Georgia. Marie, welcome. Thank you for being with me today.
Oh, Seppi, it is such a pleasure. I truly appreciate being a part of this. And thank you so much for the warm introduction. And just as you stated, I am a nurse with many years in healthcare IT and just so integrated into our community here in Northeast Georgia. So thank you, Seppi.
Thank you. I'm so excited. Um, so, Today, our topic and the title that we came up with, right, is
Mhm.
Tech, Teamwork, and the Power of a Thank You.
Yes.
It is a CNIO's Guide to Meaningful Innovation. What we do with the technology, how we do it, and how we ultimately are impacting our team members, our employees, and our patients. So, you said that innovation begins with relationships.
Yeah.
How does rounding your frontline visibility, being present with nurses, directly influence the success of these new technologies that we deploy?
Uh, I am so passionate about this, Suppy, because I just truly believe that you can have all the technology and all the innovation in the world, but if you are not truly connecting with the people, that really is truly the secret sauce because they're the ones to adopt the technology and to use the technology. And right out of the bat, what you just said, Suppy, about rounding, that just so resonates with me. I think that rounding is so foundational because rounding builds the trust. It is so vital that you're partnering in IT with those that are using your technology, and rounding is a way to do that. So, as a CNIO, I'm, rounding, my team is rounding to demonstrate that kind of respect to our frontline who's using the technology in their experience of care delivery. So I think rounding is just so foundational for building that psychological safety aspect, for building the relationships with the nurses. So the nurses then are amplifying their voice during the rounding to share their new ideas and to share their concerns. And so definitely rounding is just instrumental into what we do to making innovation really shine.
And
Yeah.
Marie, because I've known you for so long, even before
Yeah.
I started in my current role, this is not just a checkbox to you. This is
Oh, gosh,
you.
no.
This
It
is
is.
This is
Yeah,
you. This is
you're right.
you making sure you're talking, connecting, hearing, listening, and it's like I said, it's you are just so perfect for what you do. Um, Now, based on what you just shared,
Yeah. Pull that through.
in your experience, what role does genuine appreciation, play into
Right.
all this? It's not just a simple thank you,
Oh, no.
but
Oh,
building
no.
that
Yeah.
trust.
You're right.
Yeah.
Well, it could be a simple thank you. And like you said, like even a simple thank you is going to validate the effort that the users are putting forth when they're adapting to technologies. But I think also, showing that appreciation and acknowledging and thank yous, it also helps to accelerate the adoption of the technology from our users because nurses, they're going to be more apt to embrace these new tools when the leader is engaging in their environment, when the leader is listening, when the leader is responding to what they're seeing and hearing with the feedback. And so it really does help with that co-collaboration. So the role of genuine appreciation, it just is another one of those foundations that really is kind of an anchor in all that we do. And it helps also connect to that culture of respect as well and that partnership. So,
Right.
yeah,
It makes you feel inclusive, included, a
correct.
part of it. You're part of that journey. And I know sometimes these are words that we often hear,
Right.
but no matter what technology we deploy, I always say we're still in a people centric industry, profession,
Yeah.
and everything we do for our teams, our people, our patients, it still is very much human touch. And when we do that, I think it makes everything we do more inclusive and more valuable. And who doesn't feel good when they're included, right? When they're a part
Right.
of something.
Yes, yeah, you are spot on. And, we all know that when you're introducing technology or a new technology or a new idea, you really do need that very first nurse influencer to really be a part of the movement. And it just really helps to further, cascade the effort. But I also loved what you said, Sepi, about introducing the topic of the human experience, because that really truly is what this is all about. It's a human experience, whether it be the patient or the nurse or the physician. It's a human experience. And I think gratitude really plays into humanizing the experience of even using all of these digital tools that we're all a part of today.
Yeah.
Yeah,
So we're talking about inclusivity and getting them, hearing their voice. So
right.
how do you incorporate that input early in that technology lifestyle to ensure these solutions include that clinical input and both from a project and operational perspective? How do you kind of incorporate all that?
Yeah, well, it definitely is something that you have to make sure with the culture of your healthcare organization, with the governance of your organization, that you are, tapping into hearing the voice of the user, the voice of the nurse. And so there's many ways you can do that, depending on your culture, depending on your governance. But I think everyone will tell you that making sure you have your nurses are at the table for the co-creating and the co-designing of any part of the technology is just a key right out of the gate. And so that has been something that, has just kind of been instilled into everything that I'm a part of, is making sure that frontline nurses are there at the table for the co-create. And that's instrumental as you initially launch your project. And then ultimately it's going to help with the adoption and the rollout and the ongoing evolution of the technologies as well. I think also as we're consumers of technology, we want to make sure for these initial launches, for anything that's net new, whether you call it a pilot or initial launch, that you want to make sure that you have those nurse champions that are also there to shape the usability of anything before it rolls out. And then you want to make sure that you do have those good feedback loops and that you do have mechanisms of communication. And so you communicate in such a variety of different methods, but you want to make sure that your nurses know how to amplify their voice for an idea, to be a part of the movement of change, and to just make sure that all that you do is aligning to those positive outcomes and to the strategy of the healthcare system as well. So those are just a few examples. What do you think, Seppi?
Yeah, no, you're spot on. And part of that relationship building and that trust is when we do hear that feedback or when we have those conversations, we also are responsible to do something with it. So if
Correct.
we take that and we don't do anything, or even if it's a decision somehow made that nothing is going to be done with that need, or maybe another
Hmm.
decision was made, or maybe technology cannot offer a different route, that feedback or that closed loop communication is so is also important, right? So that
Yeah,
that continued trust, so they know that their feedback went nowhere, that it
that's right.
it was
I am
considered.
so glad you brought that up because you're right. Oftentimes it's explaining the why something is done the way it's done, or the why a different approach will better solve the problem. But explaining that why and having those conversations is so critical as well. So that's absolutely correct. Yep.
And I forgot at the beginning to also say why you are the most wonderful CNIO in the world is
Oh,
because
let it be
you
heard.
also have a strong technology background, right?
I
You
do.
come, yeah,
I
you come
do. I
with
can.
that.
Yeah. Yeah, that's so funny you said that and that you remembered that, but you're right. I mean, I actually started my career as a biochemist, and so I very much so started in kind of that research and development mindset, and then I became a nurse, did frontline nursing, critical care, med surge, and then further evolved into being an analyst, and so very technical with the actual build and the design of an EHR, and then that later morphed into the informatics field. So yeah, so a lot of different kind of hats that we all wear through our evolution of our professional career. But I think that kind of anchors me now in this leadership role, having known all the various pieces for it to all come together.
Yeah.
Yeah.
I've seen you in action. I know
Oh,
how you interact, how you absorb, you listen, you interact with whether it's a nurse or whether it's someone on the dietary team or a provider, and really try to. I've also seen you work with Epic designers and really try to provide that feedback back to them so they can continue to incorporate ways to improve the product for our
yes.
customers, for our users. Um, so, spotlighting stories can be more powerful than just, these visuals or these dashboards or these different ways that we represent metrics. Can you share some examples
Mhm.
where positive stories or recognition has helped shift culture
Oh,
and really accelerate that buy-in or the innovation that we're trying to accomplish?
yes. I mean, I love stories, and I think storytelling is so powerful. And you hit the nail on the head. I mean, you can look at a dashboard and you can look at numbers, but sometimes it doesn't tell the story. And even if it does tell the story, what oftentimes sticks, again, we're humans and we're talking about the human experience and the human connection today. And I think stories really stick with people, and they're easier to recall, they're easier to remember, and they also connect to the heart and the empathy part of what we're doing. And so storytelling is extremely powerful, and we always start our day off with a safety huddle, and is there a safety story to share? And we're always going to remember through our work in healthcare IT, what's the story about how technology helped impact a positive outcome or helped impact a good catch. And so yes, I'm very, very big on stories and sharing stories. I think they're very impactful, and they definitely stick with a person far more oftentimes than the data and the dashboards will ever show. So there's nothing better than a feel good story that really resonates the why we're all doing this. What positive story and difference did we make to our clinicians and to our patient?
And I've had firsthand experience with you again where you build this culture. This is, again, who you are. You build this kind of culture where this concept resonates across your teams
Mhm.
and the people you work with, and you inspire others to recognize each other
Yes.
and value each other, because that is the core of your leadership style of what you represent. And
Mhm.
that's what makes you, I think, again, so amazing, and why I'm really lucky to call you a friend, but I absolutely respect you so much as a leader in our industry here. Um, So we talked through some different concepts and ways to do this. What are some of the effective strategies that you've seen for fostering this collaboration between IT, nursing, and sometimes what we do also has, a variety of different teams involved, ancillaries or whatever, based on the workflow, right? And those
Right.
frontline individuals for sustainability.
Yeah, well, I'll kind of piggyback on the last question and the conversation we had because it connects really naturally to this, and
Hmm.
that's in celebrating small wins together collaboratively. And
Right,
currently, at Northeast Georgia, we're doing a program where we're we're recognizing top performers of some of the efficiency tools and technology. So we're recognizing the nursing top performers for using macros as an example. And
right.
it's a way to partner and to celebrate being this top performer. And, and it just really, again, just kind of feeds into your culture, and you're growing those efficiency tools, and you're really recognizing the nurses and the top performers and their achievement. And so that's been extremely powerful in reaching those vision and reaching those goals. And then I think also for sustaining collaboration, it does, connect also with making sure that you're integrated with your governance structure and making sure that technology and innovation is such a key part in your governance, in your strategy, and in your partnership and all that you do as well. And being very transparent. We talked about
Yeah,
that. Being
yeah.
transparent with your communication about the why you're doing something, but also the why you're not doing something. So I think, being transparent, integrating all of this in governance,
And
celebrating
timely
your
and
wins,
and
it
timely
builds that
communication.
culture. Yeah.
I love
Yeah.
that.
Yeah.
Yeah. Um, as we're kind of closing in this conversation,
Mhm.
I also overlooked another part of our life
Yeah.
that we touch um, and collaborate on is the Georgia chapter of HIMSS. You know,
Absolutely.
you are
Mhm.
our professional development chair. You've been leading that effort for multiple years now, and really being that touch point with our educational institutions, with our students. But the reason I bring that up and
Yeah,
alongside this conversation is your passion for workforce development,
that's
for
right.
growth, and you execute upon that even in your day-to-day role as you are educating, as you are advocating for the roles, for the people, for how technology influences and plays that
Mhm.
critical piece in how we do what we do in healthcare.
That is exactly right, and it does. It's one of those things that fills my bucket, is the
Mhm.
term I'm gonna use, and that is to always serve as a resource to help elevate others, to help mentor, and, I very much so enjoy, any type of opportunity to help those students in our healthcare IT field. Cross-training, shadowing, mentoring, it's all very powerful. And I think we all need to remember as leaders how, no matter what role you're in and what evolution you're in, what what you say and how you help grow an individual, even the smallest little tidbits of advice just make such a positive difference for those out there that are just
Yeah.
getting started. Absolutely.
Well
Yep.
said. Exactly.
Yep.
Um, so as we're closing this, Marie, I would love to kind of turn the lens and focus on you a little bit.
Sure.
And would I always love closing things out to let our listeners and audience get to know Marie a little
Oh,
better. And with that said, what are some of the upcoming special plans or special areas of focus for Marie in the coming weeks or months, or anything you would love to share with us and our listeners?
oh, That's so nice. I love that. Well, I will share on a personal note, just because this just is late breaking. My daughter actually just got married this past weekend. So I
Oh,
think from a personal note, I'm just so super proud of her, and I'm so super excited to have a son-in-law, and so that's a big milestone. So our family has grown, and so I look forward to this upcoming year, and really Garrett being a part of our family now. And in addition to kind of some personal milestones, I just am so super excited about this upcoming year, and just kind of the evolution of how we're going to do this without talking about AI. But it really is a part of nursing now, and it's a part of our innovation. And we do have some exciting work where we're going to be tapping into the rollout of AI for our nurses. And
mhm.
so for me personally and professionally, that's also very exciting, as well as how we're going to leverage these new tools to continue to elevate nursing practice.
I wrote that down. Guess what? We might have to have another
I,
conversation
I
and
think we
focus.
need to. I think
Yeah,
we do. Yes, we'll do a part two.
there you go. Watch it. You're going to become a regular.
There you go. Yeah.
So, Marie, thank you so much. It is always lovely, and I love talking to you, learning from you, being able to engage and just capture your perspective. And again, Northeast Georgia is so lucky to have an amazing leader like you involved with their initiatives and their, strategic planning. Like you said, so important with the years to come with all these AI opportunities to continue to improve our opportunity to take care of our patients, our
That's right.
community, and then just playing a part of that is so inspiring and just an honor, right, to be a part of what we
It
do.
really is.
And just
It
the other day,
really
I was thinking, some days you're like, am I making a difference? Where is
is.
it going? But
Hmm.
we all have to remind ourselves, these, even if it's small, incremental opportunities or progress. And sometimes you have to go forward and backwards, and it might seem like a dance, but we collectively do make a difference, and we're all in it in whatever role, title, or background you have.
That's
Ultimately,
right.
our heart is in the care and quality of what we offer to our patients, and you are making a huge difference. So, thank you for what you do. Thank you for how you engage with our community, even outside of your professional role. And again, to our listeners, thank you for listening to DHN today and listening to our guest, Marie DiFrancesco, who is the CNIO at Northeast Georgia. And again, we hope you enjoyed it. And we're going to recruit Marie back to be our guest in the future. And I hope everyone has a wonderful rest of their day. Thank you and goodbye. Thank you, Marie.
Thank you so much, Sepi. I enjoyed our conversation.